Hello, I'm Dr Beth Quin from Springs Medical and would like to welcome you all to our video COVID-19 update.
And I'm Dr Greg Stewart and I'm a long-time GP here in Dalesford, Springs Medical, and also at Trentham.
And welcome all the Kyneton people who are watching us today. So we wanted to acknowledge what a fantastic job that the whole community has done in containing COVID so far, but perhaps start looking at some health promotion strategies, because the change to our lives has been absolutely extraordinary, and that's brought about some really significant challenges. Yeah.
So one of the first things I'd like to talk about is smoking, which has been a big issue at Springs Medical all the time that I've been working here, and we know that people in rural areas smoke more than people in metropolitan areas. About 16% of Australians do. We also know that people who are smokers who have caught the coronavirus have done badly, and this is why people in northern Italy and China, particularly older men, have done quite badly with when they get the coronavirus. So it's a good time for people at home, now that we're in the lockdown, to think about that. The average number of times people need to quit cigarettes successfully is 6, maybe 1, maybe 12, but it's 6 times. Unless you have a go, you're not going to quit. Most people who smoke do want to stop. So this would be an excellent time to stop. All of the GPs here at Springs are all full bottle on lending assistance, giving up cigarettes. We also have a nurse, Vicky Sumblom, who's dedicated and a terrific guide and help also for stopping smoking, and appointments can be booked with her. So yeah, it's a great time to think about smoking cessation and
feel better, do some exercise as well, save some money, Greg.
Of course, the price of cigarettes is only going to go one way, that's up. The taxman's happy, the health people are happy, it's only going to go one way. It's going to get more expensive. So a great time to stop.
And look at it in terms of a whole health, doing something positive for yourself in these challenging times. The other thing that we've seen a lot of in the media, and we don't quite know how to process that is that alcohol sales, I noticed from some American statistics, have gone up 55% in this last few months compared to 12 months earlier, and I think Australia's had a similar burgeoning of alcohol sales.
Whether people are putting it under their bed, maybe they're drinking it. Anyway, I think in the lockdown time, it's good to keep good habits, and one of those would be to enjoy the alcohol if that's part of your diet. Enjoy the alcohol. We have some fantastic wine and beer producers in the district. Enjoy it, but keep it at a safe level.
What's the safe level?
Well, it's recently changed. The NHMRC, that's the National Health and Medical Research Council, the peak body in the land, they recently changed their guidelines that people would drink no more than 10 standard drinks per week.
Per week?
Per week. And that, pre-2009, we'd say to our male patients 4 standard drinks a day. So it has come down.
10 a week, and 7 days in a week, that's not even 2 standard drinks a day.
And no more than 4 standard drinks at any one time. People have crunched the numbers. One of the things that has changed, there used to be a misconception that alcohol was good for your health. In fact, the data has not backed that up. In fact, nowhere has it done that, and they've looked at across the board, and so that's the guidelines for those people and other people. So if you're breastfeeding or pregnant, no alcohol is recommended. If you're under 18, no alcohol. And people over 60 don't process it as well.
So how do we look at that right now in COVID times? We know that people have bought a lot more alcohol. We don't want it to be slipping into bad habits or habits that then continue on.
I think it's great to enjoy alcohol. However, I think it's good to keep the guidelines in mind. Maybe one day, occasionally, you're above the guidelines, but if that's the guidelines and you aim for them, I think you're better off.
And we know that alcohol impacts upon our immune system. We know that alcohol is a major risk factor for breast cancer, and a lot of women aren't aware of that. Yeah. That 1 in 7 of breast cancers is due to excess alcohol. So it's there impacting upon our immune system, and it'll be an important way to protect us against poor immune response. Yeah.
So I guess our message is in these lockdown times, it's good to enjoy alcohol, but keep it within the guidelines.
And what sort of, so for people who are aware that they may have difficulty with alcohol and they haven't yet wanted to speak to anybody about it, maybe phone consultations are actually a great time to have those sorts of discussions.
It's definitely in the brief of all GPs. We all know what a safe amount is. We all know the aids that can lead to that. We have drug and alcohol workers at the Dartford Community Health Centre. There are different techniques to try and reduce your alcohol that we could go into, about decreasing the potency of the alcohol you drink, maybe drinking later in the day, making sure you have at least 2 alcohol-free days. There's all sorts of tips there, but I think a great time to discuss with your GP. And again, this is in the brief of all GPs.
What about other substances? So people who've got problems with non-legitimate substances, or in fact legitimate prescription medications. Yeah. We know a lot about prescription medication abuse.
Well, probably I'd mention marijuana, which is a widely used drug, of course. There's been debate over the years, is it good for your health or not, and some people swear by it. I think the thing we can say for sure, that people who use heavy quantities daily, it's almost certain that it's quite detrimental to your health. So that'd be a good thing to look at, and using same techniques about trying to limit the amount, timing, days off, that sort of thing. That's a good thing. There can be quite a profound withdrawal syndrome if you are a heavy user. So this is something you may need help with. You can speak to your GP, again, the drug and alcohol counsellors at the Community Health Centre. So it's something to address. Yeah, definitely. With regard to other drugs, prescription drugs, opiates, definitely can be of concern. We've heard of the opiate issues in Australia that's mirroring what's happened in the US, a bit with the availability of drugs like endone, oxycodone, as well as the illicit heroin. If people have an addiction to those drugs, really they often need help. There is good help available. There's some of the GPs here deal with these issues. Suboxone, methadone programs are available. So sometimes, a lockdown like this, when you can't move about and maybe buy these drugs as easily as you can, might be a good time to address these things.
And I think what we know in lockdown is that our anxiety is worse. So when we're anxious, our pain levels or our resorting to the way that we usually manage anxiety, be it with illicit substances, that we're going to be more provoked to resort to that sort of behaviour.
That's right.
And so it's a time where it's really great to get help and support if you need it in that area.
Well, one thing I'd just like to say is I think we've done a great job as a country. Some of it's good fortune, some of it's good management. I think the management at Springs Medical has been fantastic. They've behind the scenes, and that's not me anymore, but I think the management have done a great job here. I think I'd like to single out the chemists, who I think are doing a great job here in Dalesford and surrounding chemists, working tirelessly. They must be exhausted. I see what they do, and I think they're doing great. Yeah.